Time now for this week's Health Matters with PA at Large, Lynn Szabo. How you doing this morning, PA?
I'm doing good.
I'm calling you PA from now on. Hey, PA.
Okay. I'm a PAC. Okay.
What's PAC? What's the C stand for?
It means certified.
Ooh.
It means I take a kind of a medical version of the bar exam every 6 to 10 years.
Oh, wow. Okay.
Yeah.
Does it change much from, do you get like...
medicine changed. It's changed a lot. Actually.
I guess so. Yeah, right. Will there be lots of COVID stuff on the next one?
I don't know. I don't have to ever take it again because... You know, I've arrived. So
Could you get double certified to become Tupac Lynn Szabo?
God, that is super clever.
That is good.
Probably, yes. You can get board certified in multiple things.
So
there we go.
I was thinking PAOG.
Yeah, that's it. PAOG.
The original PA.
All right, so I am going to step aside and turn this over to
Yes, you
Persephone Rose, actually. Not yet. I haven't. I'm going to step aside. Allow me to step aside.
You will not allow me, and I will take my stance. Hi, Persephone Rose.
Good luck with this. Persephone's been a serious bee today.
Dude, I was uncontrollable this morning. You should have heard.
It was,
I guess that's going on YouTube now since we've referenced it.
Well, I kind of like that in a young woman. I think you have to know your soul, so bring it.
So today's Health Matter is going to be a little different. The producer's out here asking questions, but we also have Mike Thornton, Paul Kritz. If y'all have any questions, please ask. But Lynn, we're talking about the teen clinic.
Yeah, my favorite thing.
Yeah, I'm excited about it. I've got to say, when you search the teen clinic, nothing really comes up. So let's start at the basics for those who don't know. The teen clinic, it's the building right in front of College of the Redwoods.
It's the clinic that's located in the building. So I'm the provider there. It's run by Open Door. It's every Tuesday afternoon from 1 to 5. And we pretty much take all comers. It is designed to be a teen clinic, but we've seen people outside of those age groups. And especially people who have been longtime patients at teen clinic. They never want to leave. It's amazing. So,
I think it's a good sign. If you feel comfortable, it makes sense you would want to stay.
Right, and we make that happen. So we're addressing reproductive health care for teens in Delmarva County. So that comprises men, women, and I'd really like to get more trans people, trans teens in there.
Nice. So there's definitely a focus on like trans teen health, which is something we're lacking, I hear, for lack of a better word.
Yeah, it's a safe place to go for trans health, especially trans reproductive health. I imagine can get kind of, there's a lot to consider. So
can second that.
So we've had some trans teens in there, and I think they felt welcome. I hope they do. So.
I'm curious, and maybe this is something more down the line. Would the teen clinic possibly be a place trans teens could go for HRT or hormone replacement therapy?
I think that's open to discussion, actually, because there's Open Door actually has in Arcata has an amazing trans team down there, and we haven't really talked about that, but I think they're open to increasing medical presence up in Delmarva County, and whether it's me that's doing it with their support, or whether it's another provider who's there at the same time, or in the main clinic at the same time. I think they're really open to making that happen.
Awesome.
I think Avi's doing a story. Are you working with him on that, or it's not that far along yet?
I've not talked to him on that yet,
okay,
but
surprise.
I think that's something he's going for.
Yeah, you'll be talking to him.
But yeah, I mean, starting HRT myself at like the clinic here, they're supportive, but they don't know what they're talking about, and they're pretty open about it. They usually end up saying they have I think my doctor said he had to go ask someone else like pretty much everything about it, but he was all on board of helping me start. So I think having a place with a focus, especially for trans teens, because it's pretty intimidating.
Yeah, it's well, David Horowitz is the PAC who does trans health. He's the actual provider. He's got a team with him. There's a man named Jack Allen who's kind of an outreach person, and you'll probably hear from him later. But they're established protocols within the Open Door system of how to treat transgendered people.
Awesome.
So let your provider know that if they don't know that already. Then they can reach out, and things are really laid out and pretty clear from the medical standpoint.
Nice. Mm-hmm. It sounds like the teen clinic has quite a lot going on. I almost get the image of like when you think about libraries and you just think check out books, but then you find out there's more services. So if you walk into the teen clinic, what exactly can you expect to? What services can you expect to get?
So I think you can come with the expectation to get education and exams and medication and lab testing for all aspects of reproductive health. And for teens, the focus is on pregnancy prevention. That's a big one in Del Norte County. It's also STDs, so diagnosis and treatment. And then people oftentimes leave with contraception, either that they need like immediately or maybe last week, or that they're kind of thinking about moving forward in their sexual lives and they're thinking ahead. Yeah. So any of that. And I am a general medical practitioner, so I can be talked into almost anything, except pain. It's not a good place to get pain.
Not a good place to get pain.
Yeah, dealt with.
That makes sense.
Yeah. So.
Or be in pain, I guess.
Yeah, hopefully nobody is.
I mean, that sounds great. I'm not quite sure where testing happens, except now the teen clinic. Last time on Health Matters, we were talking about Del Norte's notorious strain of chlamydia.
Right. So there's a couple things going on with that. I think providers were always told in meetings that Del Norte was number one, and that actually is not true. But it is hard to find data about it. Number one is Fresno. So in case you're wondering.
Oh, Fresno.
Yeah, and it probably is like frames in a film. It probably changes over time. So these data come from about 2013 to 2019 that I was looking at. We're still kind of up there, but we're not super notorious anymore. However, there is a little gonorrhea chlamydia thing going around right now. So I am testing everybody in teen clinic.
So if people want to get tested, the teen clinic is a place to go.
It's almost like I'm testing everybody, and they may not come in with that in mind, but being a teenager is a risk factor for STIs, and so I'm just testing anybody unless they opt out.
I mean, it's scarier to get an STI as a teenager than an adult, I'd imagine.
It is. And one thing they might ask is, like, that sounds expensive. Is the bill going to my parents?
I was actually going to ask that next. How is...
Right. Or if I'm positive, are you calling my mom? No, the answer is no. Most of the people that we see are in what's called Family Pact, which is a reproductive health grant furnished through California. And the services are available confidentially. So nobody gets a bill. Nobody gets a call to their mom. We're really careful about the pharmacies calling and texting, because it's kind of standard procedure. Like, if I picked up something at Walmart, they would text me and tell me when it's ready. So we make sure that as much as we can, some things slip through, but we keep it as private for the teen as possible.
Yeah, from firsthand experience, that was actually a big thing. Is my partner and I, their mother knew because you get texted results from the doctor and like, hey, why did you start this? And then awkward conversations. So having confidentiality and just being able to seek your own reproductive health, I'm surprised that we have a resource like that and that it's something we don't really know that much about.
Yeah, it's interesting. I once had a pharmacist call me and said, what's this Family Pact? And that I thought was really weird because it's a pretty common form of payment for services. So I think not only do the teens not know, but the professionals in the community either forget it's there or don't know about it. It's been around for at least 20 or 30 years. Long time.
Do you have any, as I'm trying to figure out how to phrase this, any alliances or bonds from the teen clinic? Or is the teen clinic working with anyone, or is anyone helping to promote them? Or
we do. You mean like our Instagram? We have a somewhat sad underground Instagram.
Well, Instagram's a start.
Yeah. So Open Door advertises on the teen clinic in Del Norte on the Humboldt County Facebook page, even though they're aware that might not be the most effective way to reach out. Okay. So we have peer advisors. We don't have one currently. So that might be an interesting job for somebody who's looking at starting in the health career profession. So, but what those peer advisors do is they'll actually talk one-on-one with the patient. They'll take vital signs. They'll get urine samples. Oftentimes we do pregnancy tests. There's a lot of that. And then they kind of present the case to me really briefly, and so that I have an idea of what the person's here for, and then I take over from there. So that's actually employment, like gainful employment. I don't know how much it's paid. I think slightly above minimum wage, and it's every Tuesday from 1 to 5. So, but the good thing is you can get a start in medicine, like a good letter of recommendation. And we currently are looking for people, and it doesn't really, gender is not relevant. So we've had male peer counselors and female peer counselors. I don't think we've ever had a trans peer counselor, but that would be cool. And so that might be something somebody's interested in doing. Just show up at Teen Clinic and talk to us.
Yeah, so if there are any young folks hoping to get an early start on the medical career,
right.
Sounds like a great opportunity.
They'll give you education about like birth control methods and symptoms of STIs, and I think they're hoping that that person is kind of a liaison between the student body at the high school and then the teen clinic. But we have a lot of exceptional people that have done it, so it's really cool, and they've gone on to great things.
Nice. That sounds awesome.
Yeah.
Yeah. So the grant covers most of these services. Do the teens have to pay anything, or
no? You do have to fill out some paperwork that says what your income is and what your family's income is. Almost everybody puts 0.
That's fair.
You know, nobody really. I don't even know what the cutoff line is. It's probably like 2 times the upper poverty, but almost everybody in Delaware meets it, the criteria. So you don't. It looks like a scary adulting moment when people get handed that and they read it and they go, I don't know what my parents make. Parents aren't relevant in this.
But I remember getting the, like, what are your parents? And then, like, the brackets and
right.
the levels, and you have to make sure you're within, and that can be pretty...
Right. I just taught my girls to say, what? Huh? And then somebody will kind of point you in the right direction.
So kids, just try 0.
Yeah. Don't. No, just...
No, you should know.
Sometimes in life, it's a good skill to provide less information.
That's true.
And I'm not advocating for fraud.
Yeah, it's... I understand you're education forward, but you're not about sharing personal information. I think that...
Right.
Right. I'm trying to think how to say it. It's all the harmful parts of information kind of taken out while still keeping people in the know.
I think it's okay to say that you don't know how to answer that question. And then
yeah, because if you don't, then it's not going to help you to lie and say that you do and then put something wrong.
Exactly. But it's really available to almost everybody. So.
And I guess kind of going back to the teen clinic being more well-known, we were also talking last time about events possibly happening at the teen clinic.
I know. I have this dream. I want to do cookies and condoms.
A dream of cookies and condoms.
So,
tell me about this dream.
So I'm thinking part of the thing is that we're, the school gets out, at like 3-ish? Yeah, that's when we have a little wave of people coming in. And so I remember when my kids were in high school that pretty much they were mostly interested in eating right after school. So I was thinking maybe of making some snacks available and marketing on our almost dead Instagram as cookies and condoms. So I'm working on that. So stay tuned, folks. You can check out our Instagram.
Stay tuned. Do you know the @ for your Instagram to plug that in?
I would go to the search engine and I would do Open Door Teen Clinic and see what you get. So
Mr. Persephone will make a note for this later.
The cool thing is it has a big picture of the huge sign that's in front of the building.
The huge sign is pretty helpful.
You would think would be a can't miss thing, but a lot of people miss it. So
oddly enough, yeah.
Yeah, it's hard to find an address for it. It is on the CR campus, and if you stood at the front door of the high school and looked towards CR, you definitely see the sign.
And I know most people just say it is across from the high school, and that's how I found it.
But I think if you Google it, I think that little street, which we would just call a parking lot, is called Small Avenue.
Actually, from Googling, I was surprised there's nothing about the teen clinic. It just kind of redirects to Open Door Community Health Centers.
Right.
The big one.
Yeah, way more focus on teen clinic in Humboldt County.
Yeah, so I think anything that we can do to bring some focus to the teen clinic here would be a service.
Hence our discussion.
Okay. Do you guys have any questions so far?
Open Door Community Health. That's Open Door Community. I'm looking for the Instagram.
Oh, you're looking for the Instagram.
I'm gonna like and subscribe. I know that in Delaware County, teen pregnancy is such a big deal, and of course that's a big part of what the teen clinic does. What about if young mothers, teens with kids? Are there healthcare options there, or is that time for them to go to Open Door? Can a young
I'd be
mother
glad to see them.
Really? Just bringing in kids, and I mean, if the children have issues, if you're coming in to, kids got sniffles.
So how are you defining issues? I mean, are
I don't
you
know.
like general
How do you
medicine?
define issues? Seems like it's the more important answer to that question.
So mothers bring their teenage kids in because they have questions about birth control.
No, I meant teenage mothers bringing their kids in.
Bringing in a sick child?
Yeah.
I don't think I'd turn a sick child away, but it's not the best.
That's not what the teen
not the
clinic
best
is.
avenue.
Yeah.
I'm trying to think, do I have the tools to look in a kid's
Yeah,
ears?
and right, you've got to have the little stuff, right?
I don't really have the tools for that, but you could come in if you need help and you don't think you're getting it or you're confused on where to get it. We're a really good resource. My colleague there is Annabelle Dominguez.
Mm-hmm.
Not only is she amazing, but she's like a central foundational person at Del Norte Community Health Center. And she's also bilingual. So ella habla español también. Okay, Annabelle Dominguez. Okay, so if somebody has a question, and they don't speak Spanish and they're wondering if anybody there does, both Annabelle and I do. So,
but it's like even if you don't know the answer, if you have a healthcare question, if you're a young person and you have no idea who to go and talk to, a good place to even just begin would be to come in to talk to you. It would be really
good. And, we can direct people to more appropriate venues if we need to. And we can also, in medicine, there's what patients can do to get what they need, and then there's what providers can do to help patients get what they need, like the backdoor phone numbers, or this is the person you have to talk to. We can be more direct, so people don't have to go through trial and error.
Yeah, that's an important sort of inside information to get.
Be glad to help.
Yeah, I do have a question. The teen clinic is open on Tuesday only, is that correct?
Tuesday afternoon from 1 to 5. Historically, it was Wednesday too, but
I guess my question is why is it only open for the one day? Is it funding or? I'm just curious.
I think it's provider time. I think COVID messed it up a little bit too. I mean, they brought us in March 2020. They brought us into the mothership, which I'm not sure why they did it, because there were more sick people kind of congregated there. I don't know if anybody's ever been in the teen clinic, but it's a sweet little clinic, and it's closed most of the week. So it's a really safe place, as far as COVID. But so I think part of it is provider availability. I think part of it is numbers. I think part of it is there is a perceived need that teen clinic is not an important thing up here.
What do you mean by that?
I know you looked shocked. I was too.
In some ways I am shocked, and in other ways I'm not, because I think there's probably some people in this community who would like to wish cast that all away for different reasons if they could.
Right. I think it's political. Right. So I think there's a way we could look at it, is that it's a political block, or maybe it's more productive to look at it is it's a group of people who are making decisions who don't understand the value, because they're not women, usually teenagers, worried about their reproductive health.
Who advocates on behalf of young people like teens? Because very often they can't or don't know how to advocate for themselves on these kinds of issues.
Right. So besides us, Melody Pope, also a great advocate. She's a doctorate nurse practitioner, so I guess we call her Dr. Pope. But she's also done the teen clinic in the past and has been a good advocate with a focus on HPV immunization. I think might be her interest. But most of the teens, I think that there isn't much support for them actually in seeking birth control. I do know that they go out of the area. They used to go a lot to Six Rivers Planned Parenthood and now NorCal Planned Parenthood in Humboldt County for the plethora of services that they offer that are beyond abortion, but also abortion services. But now they go into, you have to, since it's harder to get appointments there, they're going more into Grants Pass, Planned Parenthood. And then up the coast, I think the next closest one might be Coos Bay. But yeah, so it's really, really hard for a teen that can't pick up their birth control pills at CVS. So, the obstacles are huge. I think that's the best way to answer that question.
If someone wanted to chime in just about the scope and the work of the teen clinic, maybe a champion being opened more or having more providers in there, who could we talk to? Is that an open door question?
Yeah, that's an open door question. The medical director of Open Door is actually a co-medical director. It's Dr. Clint Pearson and also Dustin Jaco. And 2 men, by the way, no offense, but neither of them are teenagers.
Maybe should be mentioned regardless. Right, yeah.
Right. So I think they're the movers, the best movers and shakers. Hilda Contreras, Yepes Contreras, who I think is a clinical manager there. She already knows the value of it. And Anibal Dominguez already knows the value, but they're good message carriers. And then also, Tori Starr is the CEO of the Open Door system in both counties. And he would be where I would go.
Okay.
I would write a 5-sentence letter saying we need this.
What would those 5 sentences be?
So, Del Norte, I am so-and-so. I'll just write it as if it's me, but there's no reason for me to write a letter. I can say it in a Zoom meeting. But so, my name is Lynn Szabo. I'm a physician's assistant providing services in Del Norte. I have observed that Del Norte teenagers have a lack of access to, let's say, age-specific and interest-specific health care. I know that the teen clinic has been really important in providing this, but it's open limited hours. I'm wondering why this beautiful clinic couldn't be open longer. What information can you provide me that would answer this concern?
Interesting. Okay. Yeah.
Is this something that the healthcare district could or should be involved in?
Yes, I think teen reproductive health is a super important thing, especially here. But again, I'm wondering who is the teenage-friendly voice there.
Yeah, no, I don't know. I mean, I'm just thinking because my understanding is that the healthcare district, part of their mission is to promote health and healthy lifestyles in Del Norte County. And I'm wondering to what degree they have or should be involved in making sure that this obviously very needed service and clinic is able to provide as much service as is needed in this community.
I think it's off their radar. Again, I think unless you're a teenage woman, actually, who is at risk for pregnancy, it might be off your radar.
Wow. Interesting.
I mean, it's like Abbott in Texas right now. So women are just going to abstain. So not going to happen.
Yeah, right. Well, yeah.
So not going to happen. And it's sad because I want to, part of the reason I wanted to talk to you, Seth, is that the delight that is the teen population of Del Norte County and what they, the challenges they face and how they conduct their lives and how they go through kind of their trial and error process is like really amazing to see. I don't know if you watch Netflix, but I watch Sex Education just to pick up tips.
Wow.
It's kind of like that in Del Norte County, only not filmed. There are amazing. This group of people are doing amazing things. We should give them what they need.
Definitely. I mean, Mike, that was a great question on if the healthcare district should prioritize that. It's the health and safety of people here. Anyone with a uterus has quite a lot to take into account, and people aren't making it easy. Just talked about the Texas laws.
Yeah, and
limiting
especially
those.
taking the judgment out of it.
Yeah, the judgment, the confidentiality
The fear,
part of
the
it.
fear, yeah.
It
Fear.
seems like you're creating a very safe environment. Is there, if there's anything that we can do to support, maybe tell people that there is a teen clinic. I think that's something.
Right.
That's something I would love to
like
be on.
a regular PSA that plays too.
Yeah,
That'd be cool. I think I'd like to reach out more to localized advertising, which is something that Tory Star might need to hear. And I think I would like to reach out more to the teen trans community.
Absolutely. If I had known about this in high school, things would have been a lot easier. I actually have another question. Could the teen clinic help youths going through mental health crises? Is that
yes, in the sense that we're kind of like the first place where somebody could access and then get directed to better resources. Yeah,
Fantastic.
So we talk about that. And intimate partner violence, a big deal, huge deal up here.
Yeah.
That we're a safe place to go and talk about that. We are mandated reporters, but we're also supportive. So, that would be a good place to come and get information. Let's see, who else? I'd really like to reach out to the men. So the teen men, I don't see very many of them. There are a couple of them who come in with their partners and seem to be making decisions and kind of like a co-responsibility thing. They do come in slightly terrified that I'm going to make them drop their pants, which I never do. I guess
it's part of clearing up myths like that.
Yeah, it's just not a thing. So you can get in and out of teen clinic and have your clothing remain intact.
Yeah.
And I think that there's a lot more we can offer them.
We're at the end of our time today, but I think that this is an episode that we should get back into, frankly. I think if I had known these services were there when I was in high school, I'd probably be a lot better off. And knowing that there are ways to improve them, thank you for coming in and talking about it.
Yeah, super cool. Thanks for inviting me.
Is there anything that you wanted to get to we didn't get to? Anything you want to say that we didn't say?
No, I don't think so. It's a safe space to get the reproductive health that teens need, and we're willing to expand beyond that if somebody has a need, so we can be a good resource for other people too.
Sounds like if you're a teen with a health question or just not sure what to do, it sounds like that's a good place to go. Tuesdays 1 to 5.
You can ask me anything as a clinician. I have heard it all.
Nice.
So you can ask
And
me.
you have a job opening.
And you have a job opening.
Yeah, we do.
Yeah, that's also important.
It's actually two job openings.
Frankly, there's a lot going on down there.
Yeah. Okay, contact info then. Dropping in. You've got hours 1 to 5 Tuesdays. Mm-hmm. Is there a phone number? Is there a website? Is there? We know there's an Instagram.
So just shh, don't tell anybody. It's under the radar.
I'll add the Instagram in the video of this.
It's a private account.
So you can call the main clinic, but the best person to talk to at the main clinic is Annabelle Dominguez. So she is like the soul of healthcare, I think, at Open Door Clinic, and she is really an advocate for the teen clinic. And so let's say your personal question or issue happens on a Thursday. Who do you call? Annabelle Dominguez, and she can she's very responsive to people. She'll get you moving in the right direction.
Great. Yeah. There's good outreach. There's good community outreach.
And she knows how to find me. I'm around.
Turn on the
PA at large, Lynn Szabo, thank you so much for coming in and talking about this amazing service that has been right in the center of town all this time, and we just don't know about it.
Yeah, it's cool.
All right. Well, we'll catch you next week. Next week's Health Matters.
Yeah.
Will do.
All right.
Of all the radio stations that tell you they love you,